All right, so we are looking at intraplacental hemorrhage. So intraplacental hemorrhage is literal to me. Intraplacental, once you hear intra, it's actually inside. Placental is placental. Hemorrhage is bleeding. So there was kind of like a bleeding, and this bleeding kind of like occurred in the placenta. All right, that is what it means. The retroplacental hematoma. So they usually call it hematoma, subchorionic hematoma, the rest. So this one is just also known as intraplacental hematoma. It's a rare form of bleeding. It occurs within the placental tissues rather than behind or around it. Okay, so it's considered a subtype of intrauterine hematomas. Do you understand? It also includes retroplacental, subchorionic, then subamniotic hemorrhages. They are just trying to talk about like the, how will I put it, the locations of the bleeding. Do you understand? So what it is, location, the hemorrhage occurs in the intervillous space of the placenta. So there is, all right, a bleeding inside of this place. Okay, now for the different types, we're trying to talk about different types, different locations within that location. Appearance is often seen as what hypoechoic area on ultrasound. Sometimes is mistaken for placenta infarction. All right, so next you see it there. Histology shows what hemorrhagic areas with signs of microangiopathy and placenta infarction. So clinical significance: if you see a bleeding in placenta, you can be, suspecting that some possible complications will come up. So complications like placenta insufficiency, intrauterine growth restriction, preterm labor and delivery, premature rupture of membranes, preeclampsia, second trimester miscarriage can also occur. Stillbirth may also occur, right? So diagnosis is all those images, right? Ultrasound, all right? Ultrasound Doppler flow studies to monitor the blood vessels, MRIs. So management, close monitoring, they can also be given antihypertensive drugs, then also corticosteroid drugs for the baby, right? Corticosteroid drugs for the baby. Then we also plan on the delivery, also trying to handle all the complications that may actually come up during the time of delivery.